What is the long-term success rate of adjuvant stomach cancer chemo? Imagine fighting stomach cancer with a combination of surgery and chemotherapy, aiming not just to remove the tumor but to give you a better chance at long-term health. When chemotherapy is given after surgery, called adjuvant chemotherapy, it has been shown to improve survival chances for many patients. Studies have found that in some cases, patients with advanced stomach cancer who received adjuvant chemotherapy after surgery had a 15-year survival rate of about 57%. This is compared to around 46% for those who only had surgery. So, adding chemotherapy can make a real difference over the long run. For patients with stages 1 through 3 stomach cancer, the 5-year survival rates can be quite promising, reaching up to about 70% when surgery is combined with chemotherapy. But it's important to remember that outcomes can vary based on individual factors like the extent of the disease and how well the patient responds to treatment. Patients with more lymph node involvement, especially those with a higher lymph node ratio, tend to benefit more from adjuvant chemotherapy. This means if more lymph nodes are affected, chemotherapy after surgery can significantly improve survival chances. In cases where patients undergo chemotherapy before surgery, known as neoadjuvant therapy, some achieve a complete response where no cancer is found after treatment. These patients often have excellent long-term outcomes, with 5-year survival rates exceeding 80%. For them, additional chemotherapy after surgery might not add much benefit. On the other hand, for metastatic stomach cancer, where the disease has spread to other parts of the body, the outlook is much less optimistic. The median survival for metastatic cases remains around 6 to 14 months, even with chemotherapy, highlighting that the long-term success of adjuvant chemotherapy is mainly relevant for earlier or locally advanced stages. Overall, the success of adjuvant chemotherapy in stomach cancer depends on many factors, including the stage of the disease and individual health. While some patients can see significant long-term benefits, others may have more limited outcomes. Ongoing research continues to refine treatment approaches and identify which patients are most likely to benefit. It's always best to discuss your specific situation with an oncology specialist who can tailor treatment plans based on your unique circumstances.